Hello and welcome to this session on flare planning, and this is brought to you by the Coventry AxSpa team, and this is also based on the information provided by the National Axial Spondyloarthritis Society. The information today is a summary guide and based on the information provided called Managing My Axial Spa Flares by NAS. For further information, please access this on the NAS website. So to start with, what is a flare plan? AxSpa, or axial spondyloarthritis, can have times when symptoms are more manageable and at times when they can flare. So this would be when things appear to be worse. This may include a change in pain levels, fatigue and joint stiffness. So understanding your specific flare features, which are personal to you, can help you to try and manage them and adapt to these changes. Having a flare plan helps to break down all the things that you think might be contributing to your flare pattern and to look at the things which help to try and reduce the duration and frequency of flares. It is really important to highlight that this is individual to you, it will change with time and there will be differences throughout the year. So it is important that we continue to review this alongside your AxSpa team, but also alongside friends and families or whoever you feel you can access for support. What is a flare? Now, a flare is very specific to you. Based on research and patient summary information, the three key areas that appear to be identified by the majority of patients are that a flare can include pain, stiffness and fatigue. So what are some examples of triggers that might contribute to an AxSpa flare? An injury or illness may change your access to medication. If you are on a biologic drug and you need to have antibiotic therapy, you will need to stop that drug, which may possibly contribute to flare of symptoms. It may also limit your access to exercise alongside any recent injury, and this can in turn impact on pain, fatigue and stiffness levels. Weather changes. Now, there is no direct scientific evidence to support that damp and cold weather changes joint pain and stiffness, but what we do know is that when it's damp, wet and cold, people are much less likely to exercise outdoors, they tend to walk less, which can contribute to stiffness and pain levels, whereas when it's sunny and dry, you're more likely to engage with outdoor activities, be more active, which in turn can improve these symptoms. Missing medication dosages, this can include your biologic drugs, your pain relief or anti-inflammatory medication, can impact on how well you're able to control your symptoms. Emotional stress has been linked to many musculoskeletal problems, including inflammatory joint disease such as AxSpa. We know that at times of emotional stress, this has a direct link to your pain levels and your processing of pain information. This is something we will revisit further in another education session. So alongside change in activity levels, some patients might find they have a flare of symptoms with a rapid increase in activity. So have you had a new change in job, a new family member such as a baby or a pet at home that you're having to do more lifting that is increasing your daily activity? Is this something that we may need to review? Or a significant decrease? Have you had a period of time off work? Have you been on holiday with lots of rest and relaxation, which may contribute to more stiffness? Everybody is different here, and it's very important that we look at your current activity levels and map these different changes for you. Excess fatigue or getting less sleep is a significant trigger to a flare. Now, there are lots of factors that impact on sleep, and this is something we will do as a separate session, but it is very important we look at your current sleep levels and whether this is contributing to your fatigue. And finally, diet and smoking. We know these have been linked to higher inflammatory disease activities, not just with AxSpa, with other conditions such as diabetes and heart disease. And it is important that we factor in a healthy diet and access to smoking support if you wish to try and help control your symptoms. So to start with, when trying to map flares or how to manage these, it is important that we look at what you can do. So it's helpful to write a list of all the things that you can do currently in ascending order of ability. So as part of this, consider your things you're managing to do at home, at work, and the hobbies that you're able to complete. We can then look at the things that you are finding most difficult. So please consider all of the things that you are finding more of a challenge. This can impact on work activity, activity at home, or aspects of family life. These do not have to be in any particular order, but please include all of the areas that you find that are more challenging at the moment. So then what can we do with this information? So it's important that you can try and discuss this with your AxSpa team, and we can look at things that can help tackle some of these challenges. We may suggest some gentle exercise, which can include cardiovascular exercise, walking, swimming, or some physio stretches to try and help with your stiffness and your joint mobility. We may consider a medication review, so discuss with your pharmacy team, the nurse specialist, or your consultant helpline whether we need to review your current medication plan or the way that you are taking your current medications. Other things that people find very helpful are looking at breathing control for relaxation. This can help with your chest expansion, your general levels of relaxation and well-being. It is important to consider things such as a warm shower or bath, which can help with stiffness, including a daily posture check. Now this is considering the positions you're working in, whether you're based in a desk at home, driving, whether you're lifting or caring for others, and what are the daily postures associated with this that we can review. Considering meditation and mindful techniques have been linked to control of chronic illness and chronic disease, and it is an important way to help you try and relax and control your symptoms. It is important that you prioritise your sleep and look at ways to help support your current sleep pattern. Again, as mentioned, this is something we will discuss as a separate module. Please talk to your family, friends or colleagues, or contact the NAS team or your local Coventry NAS branch for support, whether this is other people you know that also have AxSpa that you feel have a good understanding of this problem, friends and family that understand you well and hopefully can identify when you're feeling particularly good or maybe not so good, and also looking at what support is available to you at work. Now through your occupational health team you have access to appropriate adaptations and support in the workplace, but please do not hesitate to contact them and discuss this further. This is something we will continue to discuss as part of the module Living with AxSpa. These are just some ideas. There are many, many more. And again, as you go through this with your AxSpa team, this will change with time and you will hopefully find what you find most supportive for you, or things that you're finding maybe less supportive that we can identify and look at other options. Now, at times it can seem overwhelming to try and put all of this together in place, because at times when you're struggling, you're in pain, you're tired, it's hard to then work through all of these things to make things better. So we've tried to put together a toolkit of ideas, something that you might be able to map out when you're not in a flare that you can then refer to make it easier to try and process some of these things and look at what options might be available for you. This can include your medication plan, other things you might find helpful for pain relief, whether it's heat, ice, cold, TENS machines, exercise in water, for example. What are your flare must-haves? So things that really help. Is it that you know when you're in a flare you have a supply of medication available to you in an easy accessible place? Is it that you know you want to be able to speak to other people that you know understand the situation, such as your NAS branch or your AxSpa team? Is it that you know you want to have access to heat or relaxation techniques? Also consider your activity planning. So if you know you have a particularly busy week coming up and you've got lots of activities at home, challenges at work, what can be prioritised for that week, rather than getting through the week and thinking I'm going to deal with it afterwards, potentially knowing it may respond in a flare? How can you pre-plan that to make it a lot more manageable, to reduce the risk of further flares? What's your exercise plan? So what's your go-to exercise, your daily stretches to do on a good day and a bad day to really try and keep things moving? And what can also help you feel better? What exercise do you enjoy? How can you try and feel that you're taking control of your symptoms? Who is your support list? Your go-to group of friends, family, colleagues or other support groups? And if you're struggling to find a list of people here that you can use, please discuss that with us as a team, as there are many people and support areas available to you. And also consider what to avoid, what is not essential in that week of increased activity, or when you're in a flare. What are the jobs that can be put to the side to review at a later date? Good examples of this are on your very busy days at work. Is it that you pre-plan your meals for the evening by using things like a slow cooker or access to planned meals, so you're not having to then stand, prepare meals, serve meals, clear up afterwards after a really long day? Or is it that actually sitting for very long periods of time on a car journey or in a meeting, are there ways that we can break this up or make it more accessible to you, having a sit down, stand up desk or breaks throughout the programme? As I said, please don't feel you need to fix all of this in one go. There are lots and lots of different ideas, but these are just some examples you might find helpful. It's really important that you try and record your flares so that when you come to your clinic appointments, we can try and track any patterns and look to see what we can do to support your current management to optimise the care that you have and to try and help improve your self-management. So it might be important to then include a list of the things you may want to consider to reduce the risk of further flares. And this is more of an action plan that we can create as a shared decision, and we can try and help you with as part of the team. It's really important to consider that not all pain or flares is AxSpa pain. So, like everybody, we all develop other musculoskeletal problems in life, and these are not all necessarily related to your AxSpa. On here is a self-help guide provided by the MSK team, and it's on lots of different musculoskeletal conditions, including neck and shoulder pain, back pain, elbow, hand pain, hip and knee pain, and foot and ankle symptoms. You can scan this QR code and this will take you directly to the links for these conditions with some self-help guides, which may be your first port of call to try. If, however, you're finding that these are not providing enough information or you're not able to get on top of your symptoms, please contact us via the patient helpline. So this leads me on to, when do you contact us in a flare? So we try and use a traffic light system to triage our flare contacts. And by flare contacts, I mean people that have called the patient helpline or emailed us on the AxSpa email. This helps us to decide the next line of management. So we will look at considering any initial self-management options that you've tried and what's maybe failed. Is there any other options? Is it that we need to discuss access to physiotherapy? Do we need a nurse review? Or do we actually need to book you in for a consultant review? And there's lots of access to different stages of your management, but we try and get as much information as we can to help with this traffic light system to ensure that you are accessing the right care at the right time. So very importantly, how do you contact us? So please make sure you know the name of the professionals who are looking after you. So this will include the consultant, the name of your physio and your lead nurse. We have a patient helpline, which is myAxSpa@uhcw.nhs.uk, and that is manned by myself, Catherine Tongs, and Dr. Blake, consultant rheumatologist, Monday to Friday. Please email us with any queries or questions and we will try and get back to you as quickly as we can, or direct your query to the most appropriate place. We have a rheumatology patient helpline number, which is 02476965723. We also have a wealth of information on the NAS website. Please can I encourage you to access this. It is an excellent resource with lots of information on all aspects of your AxSpa care. We also have the A-Stretch website, which includes a physiotherapy-led exercise regimes. And as mentioned, we have the UHCW self-care guides. This is the current email link and the QR code was on the previous slide. A little bit more information on the rheumatology patient helpline. This is an answer phone service for patients under the care of the rheumatology department at UHCW. The calls are listened to by the nurses Monday to Friday, excluding bank holidays, between 8 AM and 3 PM, and they try to deal with your call within 2 working days or where possible. When you are leaving a message, please include the following details: your full name, your hospital number or your 10-digit NHS number, or your date of birth, a contact and telephone number that we can use to contact you, and a brief reason for your call. Unfortunately, we are unable to process your call without all of the above information. And due to a high volume of calls, we will try and call you back twice only. Please note that this call will come from a withheld number. The service is not for urgent attention. In medical emergencies, please contact your GP or NHS 111 service. The types of queries that are dealt with by the helpline are questions regarding flares in your condition where self-help measures have not helped for at least 1 week. Information regarding repeat prescriptions for disease-modifying anti-rheumatic drugs not issued by the GP. For issues relating to rheumatology medications, including biologic medications. Any possible side effects from medications prescribed by the rheumatology team. If you need to ask for more blood forms. To inform of blood tests or to obtain blood test results where the doctor or nurse has specifically asked you to do so, or concerns relating to your condition or treatment that cannot wait until your next planned appointment. For any other queries, please call the Rheumatology Secretaries on the numbers listed below or via the Rheumatology Secretary's email address. For specific AxSpa queries, please contact myaxspa@uhcw.nhs.uk. For appointments, please call the booking centre on 0800 252 060. This is a free phone number. To check if your prescription is ready from the Hospital Lloyd's Pharmacy, please call 02476 966 045, and for pharmacy home care, please call 02476 966 765. I do hope this has covered the majority of contact details and information. Please do not hesitate to contact us should you have any questions or concerns regarding the information provided in this session today. And any feedback would also be greatly appreciated. Thank you.